Well, we have some big news just coming in. Total number of cases in Karnataka has risen to 530. Beg your pardon, 503. Well, 3 new cases comes to light in Karnataka. 2 new cases from Kalburgi have been reported. Dakshin Kannada, 1 case which was reported in the mid-bulletin. The death toll has risen to 19 at this point in time, while 182 of them have recovered. So this is the big news we have. 503 is the new number in Karnataka. The number of cases has risen to 503 in Karnataka. 3 new cases have been reported, 1 from Dakshin Kannada and 2 from Kalburgi. 1 more death has been reported, so the total number of deaths in Karnataka now will be 19. Especially Bengaluru numbers are on the rise. The death has been reported from Bengaluru itself now. The details about the death is that patient number 465, it's a 45-year-old female. She has died at a designated hospital in Bengaluru. She was in ICU since yesterday. They were keeping a close watch on who all were there in ICU. 5 of them were there. So now she was found to be positive on 24th of April. And now has succumbed to COVID-19. So the number of cases in Bengaluru has risen, the death cases, that is, it has risen to 5. And the number of positive cases in Karnataka has risen to 503. With 2 new cases being reported from Kalburgi and 1 case being reported from Dakshin Kannada. Probably the Sari cases, they are keeping a close watch. The influenza-like illnesses, they are keeping a close watch on that as well. We have already got information regarding the patient number 501. It is said that 501, patient number 501 was admitted, was a sweeper at a hospital. So this is the information that we have had. For more on this, I'm joined in by my colleague Deepak, joining us live from the newsroom. Well, Deepak, here the number of cases has risen in Karnataka to 503. 2 cases have been reported from Kalburgi. So what more information, what was the contact history like, and where did they get the virus from? Where did they contract the virus?
Right, Suraj, the number of cases in Karnataka has risen by 3 from morning today, and all the 3 number of cases are, most of them are from Kalaburgi, while 2 of them are from Kalaburgi. If I have to give you the patient details, patient number 501 is a 47-year-old female from Mangalore in Dakshina Kannada and is a contact of patient number 432. And she too is currently isolated at a designated hospital in Dakshina Kannada. Whereas the next 2 cases are from Kalaburgi, which is patient number 502 is a 65-year-old female from Kalaburgi, and she is a contact of patient number 422, and she has been isolated at a designated hospital as well. And patient number 503 is a 7-year-old male from Kalaburgi and is a secondary contact of patient number 425. And he too has been currently isolated at a designated hospital. And with these 2 new cases coming to light from Kalaburgi, the total number of cases in the district has risen to 38, Suraj. And with one of them being a high-risk patient of about 60 years of age, it remains to be seen how the health department officials will treat this particular patient, whether plasma therapy will be needed or not for this particular patient will be analyzed in the next coming days. And also, if you could see, both of them are all of them are the contacts of the already infected patients, Suraj. Along with that, the lady who has been identified as patient number 501 is a 47-year-old resident of Narikombu in Mangalore, and the lady worked as a sweeper in the first neuro hospital in Padil. And it is also learned that she had come in contact with patient number 432, like I mentioned, who was an elderly lady from Bantwal who died of COVID-19 and who had also been previously admitted to the first neuro hospital. Now, this particular patient was a sweeper, like I mentioned earlier, and while she was carrying out her daily chores in the hospital, she came in contact with this particular infected patient who recently succumbed to COVID-19 in Bantwal and now has tested positive for COVID-19. And also, Suraj, as soon as patient 432 had died, the staff at the hospital were also quarantined and the surrounding areas had also been fumigated by the health officials. Now, she is a primary contact of the patient who died, and now contact tracing is underway as to how many people came in contact with this particular sweeper who has now tested positive for COVID-19, Suraj.